Hello everyone, welcome back to the Anatomy Lab. Today we are going to be taking a look at the blood flow through the kidney, and we are going to start right over here with the renal arteries, go into the kidney all the way to the glomerulus, and then from the glomerulus to the capillary beds, and then back out through the veins. So to get started, you can see a very large kidney over here. And in this kidney, you have an artery going into it, or rather carrying blood into it. This is called the renal artery. So renal, just to be clear, is going to mean kidney. So you're going to hear the word renal at least a few times. So it would be a good idea to know what renal means. So renal, kidney. But furthermore, if you follow the renal artery, you can see that the renal artery then branches out to these smaller parts, which are called segmental arteries. So the segmental arteries are going to lead into the kidney even further, and then you can see the segmental artery branch again. So as it branches again and then goes in between these flower petal shaped structures called renal pyramids, these arteries are now called interlobar arteries. So between the pyramids, these are interlobar arteries, and these are going to lead towards the top of the renal pyramids, where you can see it start to curve, or rather arc, as the arcuate arteries. So this is where it gets a little bit harder to see. So let's kind of compare these two. Here would be an interlobar artery right along the side of a renal pyramid. This is a renal pyramid as well, where you can see an interlobar artery, and then going up to the curved region. This is an arcuate artery as well. Now from here, we can continue to go up into the renal cortex, which is where you'll see the interlobular artery, which is going into, or which is going to have branches that go to the arterioles to go to the glomerulus. So one thing I want you to take note of really quickly is that we have two arteries that sound very similar to each other, but they're different. Interlobar arteries are going to be along the side of the renal pyramids. Interlobular arteries are going up into the renal cortex, which then are smaller and branch out to arterioles. So please be careful. Interlobar, interlobular. Now, looking at the interlobular artery, you can see that there are blood vessels that branch out, which go to these little ball-like structures. Those, if you recall, are called Bowman's capsules, and inside of that, you can see this little tuft of capillaries. So let's briefly bring this part into view, where we can see the afferent arteriole, the larger of the two. That is the one that's coming off of the interlobular artery. But the afferent arteriole is going to lead into the Bowman's capsule, and these are now the glomerulus, or the glomerular capillaries. So this is where you'll have filtration occurring for your urinary system, but then coming out, you can see you have a smaller arteriole, which then also further branches. These are the efferent arterioles. Now, if you look at the efferent arteriole of these other glomeruli, you might also see that they go to these blood vessels that turn from red to blue. So this is where exchange of oxygen will occur, and the blood vessels that happens inside of are called capillaries. And this specifically is going to be what's called a capillary bed, but this capillary bed has its own specific name. So if you're looking in the cortex, surrounding structures such as the proximal and distal convoluted tubule, these are called peritubular capillaries. So peritubular means around the tubules, peritubular inside of the cortex surrounding these tubes. But if you look closely, some efferent arterioles will also go down into the renal medulla. So the renal medulla is going to have its own capillary beds, in this case surrounding the loop of Henle, and these capillary beds are going to be called the vasa recta. So depending on where you are, the capillary beds will have a little bit of a different name. Up here, surrounding the proximal and distal convoluted tubules. These are peritubular capillaries. And then surrounding the loop of Henle, you can see that you have this kind of ladder-like structure. This is going to be called the vasa recta. Now, depending on which capillaries you're talking about, your veins will then go into a couple of different respective veins, but luckily, these veins will be very similarly named. If you look at this vein up here, on the other side of the peritubular capillaries, these are the interlobular veins. So interlobular artery, interlobular vein, also in the cortex, but then you can also see this vein going up to this arc region. This is going to be called the arcuate vein. And if we continue, just like we did before, going along the side of the renal pyramid, you can see that over here as well. This vein, the blue blood vessel, is going to be the interlobar vein. And then you actually don't have any other kind of named veins until you go to these large veins which exit the kidney. These are the renal veins. So there is a lot of similarity between the arteries and the veins, so luckily that will at least simplify things a little bit. But at the very least, try to be careful as you're up here, and also be careful when you're looking at interlobar versus interlobular, because they sound similar but they're different. So be careful, but with that said, that should be just about it for this model. Good luck with your studying. Thank you for listening, and I'll see you all next time.